Hello, I'm Dr. Basil Constein from the ACU Online Writing Center, and today we're going to be talking about evidence-based interpretation of results. This is something that is a very important thing in pretty much any healthcare field, and also a useful thing besides, because knowing what the basis is for our decisions allows us to not only justify them, but defend them to anyone who might challenge that, which is not necessarily a negative thing, challenging a suggestion or an interpretation, but knowledge, our understanding gets more complete and sometimes revised over time. So being able to identify why you are saying something, why you're making a recommendation or interpretation is very important. All right, we're going to do an abbreviated dive into this. And so I will just mention that if you go to the ACU Online Writing Center website or our YouTube channel, you'll see several webinars that will delve specifically into the topic of case study write-ups. We're going to do an abbreviated case study report and analysis today for this assignment, but as you go further in the program, you will do more essay-style write-ups instead. And so we're going to be looking at an assignment from NURO 338. This is the pharmacology and pathophysiology course. And so we'll be looking at an assignment that's specifically about acute coronary syndrome and myocardial infarctions. And so let's go take a look here. So the assignment description begins with a preamble where we are asked to analyze a patient scenario and apply knowledge learned about cardiovascular physiology and pharmacological treatment. And this is a good integrative exercise to take the reading that you've done and look at a set of data and say, okay, well, in light of the reading, here's how I would analyze, here would I assess and understand that. And we have some specific instructions saying, okay, we need to complete the case study using a provided PDF document, and that we have also a rubric here that details in about a dozen points what you are expected to glean, what you're supposed to do according to the guidelines provided in the reading, and a few other things. So keep this list in mind because this gives a good checklist to review your assignment and see, have you done all of these and have you done them clearly? All right, so as you progress through this course, you will have assignments that require you to do more writing on your own and some that will use an abbreviated form like this. And so it's important to know how to cite and reference the course materials because they might come up more than once. Now, the main source for the form that you, if you were doing a full write-up, you would use is coming from the ACU online website. But what do we have here? Well, if we look at it, this actually tells us where this form originally came from, because we have the authorship, which is marked here in the lower left-hand corner. Keith Risher is claiming the authorship. We have the organizational source or publisher, so it's coming from his self-branded program or platform, keithrn.com. We have the title of the piece, Skinny Reasoning, Part 1, Recognizing Relevant Clinical Data, and of course you have the URL that you got this from. Now let's keep in mind that the information here is not presented in APA format. This is just how the PDF was when Keith assembled this, put it on their website. Now, if you are going to be presenting this to the outside world using an APA citation and reference, you want to show not just who wrote it, when it was as written or published, what's it called, but also how you found it. Because sometimes information is reformatted when it goes online, and so you want to include a link to where you got it. In this case, it's coming from the course website. I believe it's not publicly available with just off the internet because this is a part of a paid course. So in this case, you are acknowledging that your source for it was ACU, and if someone were to go there today, they might get a different version of this from keithrn.com. So with that in mind, let's look at how that would look. We would have first at the top our references entry, and you see that we have Risher, that's the last name, K first initial, published in 2018. The title, so skinny reasoning is a proper noun. That's the name of a particular course and method. So that's why that's capitalized that way. But the rest, and again, compare our examples here. Although relevant is capitalized for emphasis on this document, in our citation, we follow sentence case capitalization rules. So you can see skinny reasoning dash part 1 colon recognizing relevant clinical data. Only the R in recognizing gets capitalized in that subtitle. Now then the publishing organization is keithrn.com. Note that we're dropping the www. That's a APA style thing. And then we have the link for where you accessed it. And then if you're citing this, this would be Risher 2018. And I've given you 2 examples of how that might look using a signal phrase and using a purely parenthetical citation. So if you are writing whether in the case study form or in a separate paper and you're referencing this material, it would be Risher 2018. If you had more than one source from Risher that was published in 2018, you would start sorting them alphabetically and then lettering them according to which one came first in the references. So 2018A, 2018B, etc. All right, now you also might want to be citing the textbook. And in fact, I would suggest citing the textbook. As you go through your studies and your career, you will have other resources. But for now, the main course textbook is going to be a significant source that you cite. And so we want to have the full author list. And in this case, it's these 3 individuals. Again, we are abbreviating the first name. Publication year 2019. Note that the title is again reformatted in sentence case. And although the syllabus helpfully includes the ISBN, which is great for ordering that specific version of that book, in APA style, we do not include that in the references list. And because there are 3 authors here, according to the APA style rule, 3 or more authors, you're going to be abbreviating that to first author et al., Ashleford et al. Et al. Is a Latin abbreviation that more or less means and so forth, or as it goes. And so how might that come up? Well, if you were pointing out why you were doing something, then you might use a phrase like this. According to Ashleford et al., 2019, nurses must, quote, interpret results from routine investigations taking prompt actions, close quote, page 6. So whenever you're doing a direct quotation in APA style, you should identify not just the source, Ashleford et al. 2019, but also the page number or page numbers for which that quotation comes. That's not required if you're paraphrasing or summarizing, but it is required with a direct quote. Okay, so let's take a look at that form now. Okay, so looking at this, one of the first things you want to do is identify the most important things. And there are a variety of ways that you could go about that. One thing that people often find is just helpful for them to start out is to underline or highlight key details that they see in the history. So shortness of breath, 20 to 30 minutes of the last 3 days, pain is epigastric, radiating into the neck, 3 days of progressive weakness, and yes, of course, the age and sometimes the gender, because that may have a certain importance epidemiologically. As an example, there are some cancers that are more prevalent or that typically present earlier in males versus females. And so that's something that when you're making your assessment and doing your differential diagnosis, you absolutely want to highlight when it is relevant. Now, is the fact that they're a math teacher important? Probably not. Recently retired? Maybe. And things like the 40 a pack here history. Okay. So what are you going to put down here? Well, once you've gone through, you want to summarize all the things that you've looked here and make sure that you're getting the key information. And let's just go ahead and put a couple of these things in here. So if you are uh, editing this PDF, you can just type in directly. And so let's say we added, so let's say you added this piece of data, the smoking, and said, oh, okay, 40 pack years, that's a lot. And what's the clinical significance? Well, it happens that smoking will increase your risk of just about everything that you don't want happening in your long-term health prognosis. So you can say something like increased risk of myocardial infarction. And in this case, you do want to identify how you know that. And there are a variety of sources you might be using, but one of those is probably your course textbook. But whatever it is, it's going to be author and date. And this is a helpful thing to do in this exercise, especially because this answers the question of where did that information come from? And if we turn back to the assignment rubric, we'll see that the question of clinical significance and explaining that it has clinical significance, saying, oh, it has this thing according to these people, goes a long way towards that. Now, whether you are filling in this under the personal social history or whether you're filling this in under the vital signs data, it's going to be the same basic format. You list the one thing here and then describe its clinical significance over here, ideally with a citation. Some people will use page numbers in their citations just because it makes it easy to look things up, especially if they're following up on something, because where a condition is discussed in your textbook is often where there's also an action plan. Now, let's take a look at the EKG here. And so if we look at this and you look at it and think, oh, I'm seeing, is that a ST segment elevation there in lead 2, lead 3? Well, if that's what you're reading, and then you say, oh, hold on, ST depression, okay, well, that is something that you should probably be pointing out. We train over time our idea of what a normal EKG looks like, and some things like changes to the ST segments in specific leads are really important for understanding what might be going on with the patient's heart, both in terms of acute presentation and the follow-up in healing, scarring, etc. So what would you put down here? Now, I'm sure you'll have multiple observations, but what you probably don't want to be doing is listing data that is not important. Now, what is important, that's something that your course reading will help you identify. But generally, you can briefly summarize if things are normal or which things are normal, and you want to spend more of your detail on the things that are abnormal because those are the ones that will need more attention. And I'm sure the patient will appreciate your focusing on the most relevant details, which are the ones that brought them in here. Now we have some results here, and make sure to look at these with an idea of what the normals are. At this point in your training, you may or may not have seen many test results here. They generally will give you the reference ranges here. And so look at these with the eye towards, are they within or departing from those reference ranges? And of course, some of these are very important in tracking the progression of a disease. So make sure that you keep that in mind and what that might tell you about acute versus chronic presentation or the timeline of this. Because you have the clinical timeline, the history that's been presented to you by the patient, but you also have these results here that give you an idea for things like the troponin, the creatinine, that will give you, and the BMP for that matter, that will give you an idea of, wait, what stage are we at exactly, and what kind of interventions are most suited here. And so here, you'll notice that this section here, what data must be interpreted as clinically significant. This is a much larger box here. That is a strong suggestion about the things that you should be going into, especially this reminder about reduction of risk potential and physiologic adaptation. So one of the things that was drilled into me in my training was that if you think that might possibly go to the cath lab, make sure that you call sooner rather than later, and that it's better to call them and have it be unnecessary than have it be necessary and not call them. So even if there are multiple interpretations, or say your EKG was not definitive yet, uh, whether it's acute MI, that's something where if you have signs that it might be, well, okay, give us a list of how many out of the checklist that you're using do you see? Because that could change over time. Their EKG now versus their EKG in an hour, it might go from you have 3 signs to 5. And how would you act on that? Now, we have an example here for the radiology, so that they show scattered bilateral opacities consistent with pulmonary edema. Then you have that question first. Okay, what is that finding? Do you understand what that means? And then what does that affect as far as how you would view and treat this patient? Now, I won't answer that one for you because that is part of your assignment here. But if you were to look up any nursing textbook and you were to first look at the condition and see the significance, and then correlate it with in the context of a myocardial infarction, uh, you know, what does pulmonary edema mean? It's generally something that we don't get if volume is being and circulation are being managed wholly well. So, given the patient's current presentation, given their history, what do you think might be going on? Now, looking at these other ones, so often people will have experience that they bring to bear in interpreting the things before, but this is one where you especially should be grounding this in the textbook because there are very specific uh, priorities that are laid out. And so to not only say that they're a priority, but to ground them as this isn't my personal priorities, this is aligning with professional practices, you do want to make sure that you have those author date citations. And that's a good habit to go into of grounding it now because there are plenty of practices that have changed in the last 20 years. Just the other day, I was talking with a physician about changes in practice for rhabdomyolysis. And the used to be the recommended intervention for that was to give mannitol and to give aggressive hydration and to also give baking soda. Now, it turns out that these could have some strong side effects aside from the hydration, which is just going to be normal saline. The bicarb can give people explosive diarrhea, which is generally not appreciated by the patients, and can also dehydrate them or throw off their electrolyte balance after they've already done something like run a marathon that threw that off kilter. And the mannitol, well, there's a reason we don't use mannitol very frequently, aside from a few acute situations. And one of those is that it can cause a ton of diuresis and leave the patient dehydrated, which is contraindicated when they are, uh, you know, acutely dehydrated and being given aggressive fluids. So again, the patient may not appreciate being stuck in the bathroom all the time. And it turns out that in the last 20 years or so, that the best practice has gone from, oh, yes, we should do this all the time, to just aggressively rehydrate and monitor with normal saline, which is not only less expensive, easier to maintain, there are fewer factors that are being changed, but also, uh, if we start with the principle of do no harm, yes, there were some cases where it seemed that those things were helping, but with a larger sample set, uh, the literature has shown that, oh, those interventions tend to do more harm than good. Let's start out with the current recommended baseline. And so when you're looking at those nursing priorities and you're looking at these holistic care priorities, citing this textbook helps us ground it in, okay, this is current practice. And this is one of the reasons why we will periodically update the textbooks that are being used to reflect that shift in knowledge. Are you supposed to be citing peer-reviewed journal articles for everything? Not at this stage. That might come later on in your career if you go into doctor of nursing practice, but for undergraduate nursing, you're mainly going to be referring to uh, expert opinions as represented in the textbook. All right. Well, I hope that was helpful to talk through some of the rationales and how to ground your discussion of this. Again, if you are pointing out, oh, according to this source, this is important, this is what should be done, that moves us to a whole different point of discussion. If you're saying, well, yeah, this looks important to me, and then you need to add a whole bit of argumentation and evidence that really, in this context, filling out this quick, concise case study analysis saying, oh, yes, this thing, according to that person, just makes it much more streamlined. If you have any additional questions, you are more than welcome to email us at onlinewritingcenter@acu.edu. You can go to my.acu.edu, select Academic Resources Online Writing Center to schedule an appointment, and visit the Online Writing Center online. Thank you.